My name is Jodie Haak. I am the department chair for health sciences. Health sciences is our biggest undergraduate program. So we have a lot of students interested in going into medicine, they're interested in going into physician assistant programs, PT or physical therapy programs, public health. And so our program is really broad. It's intentionally flexible so that students can make sure that they get the prerequisite courses for all of these different grad programs. Some of our students also go directly into working, so they'll work in genetic counseling or they'll work in research or biotech. So lots of our students want to go directly into careers after their health science degree is finished. So there are a couple things that we are really proud of. One of those things is the lab space. We have really cool lab spaces. So what you're seeing here is our dry lab. Our students get an opportunity to learn on cadaver or donated bodies, which is a really cool thing for undergrads. Our students get a chance to work in a sim lab and actually deal with standardized patients, so they get to see what it will be like to be in a clinical setting, but also they get to take all kinds of electives to focus on what they want their journey to be. All of our students get a chance to participate in research as part of their curriculum. And then we give our students the opportunity to actually participate with faculty on campus or even off campus to do research projects that they can potentially get their names on, so they can get publications, they can get presentations. Basically, students who are interested in medical school who are in health sciences, all they have to do is make sure that they get the prereqs for medical school. So essentially what they'd have to add on to health sciences, and they can do this as part of the degree, is organic chemistry and biochemistry that are not required by our program, but we do have a flexible enough program that you can take those courses and they can count toward your. Most of our students go to grad school, so we have a really high rate of acceptance for students in the medical school, into physician assistant school, into lots of different grad programs in the health field. Those who want to go directly into careers, they usually leverage their co-op, so their work experience that they've gained as part of their program. And they can go into genetic counseling, hospital, clinical settings, research, biotech, lots of different areas where our students will go. So health sciences has two bridge programs that essentially are accelerated programs where students will go, they'll spend 3 years with us in undergrad, and then they'll go directly into physical therapy or physician assistant school. They graduate after their 4th year, but they're already graduate students. We have a very large department, and so our students have lots of different interests. So some of our students do research, so we've had a lot of students go over to Penn or CHOP. Some of our students will work in like exercise science programs or like gyms or things like that. It really depends on the student interest, but we have a big range of clubs. I teach anatomy and physiology. I'm a physiologist by training, and so I really love the advanced physiology courses, because understanding how the human body works is really why I do what I do, and helping students understand it as well brings me a lot of joy. I also like teaching a course that we have called Exercise for Clinical Populations, and that course really looks at how we can improve health and health outcomes with physical activity. My advice to anyone who is at the beginning of their academic career really is to find a place where you feel like you could be comfortable.